So like if I put a symphony
Don't
in
do
my,
it.
you said don't do it.
Don't do it.
Why not?
Selfish, but you got bills to pay. Us.
Okay, so Dr. Cancer said the same thing. She said because our livelihoods depend on you. Okay, so is it hypocrisy that I would do this for others but not do it for myself?
Are you doing plano presbyopes though?
It's like you always tell the patients, it's dependent on personality type. You're such a perfectionist, I don't think you would deal with it.
You're the 1%.
I'm a bad personality profile.
Yeah, it's one of
It won't end well.
Yeah. Not yet. You're in the beginning stages. Wait 5 years.
So what do you think? Should I put a symphony in my right eye? Is it a good idea?
Are you in selfie mode or?
Uh-huh.
You could.
You can tell she's used to
This
photo
side.
art. She's like,
No, I don't think you have to have a YAG. You'll have floaters for more of your life.
you'll have halos at night.
But I'll be able to read.
Which one is that?
You'll be able to read, but
You're
you can
just
read right
trading
now
one thing
with
off for another.
readers.
I'm trading one problem for another.
And you'll probably still wear reading glasses. 'cause
And
you like
I just
floaters,
can't get over
and
how
you
you can't
that
fix
was funny,
floaters, but you can fix not being able to read with
I
readers.
currently have
Oh,
no floaters.
Right.
So then you'd have floaters.
Then you would have floaters.
Here, and I'll tell you that I cannot read here. Is this English? The father wanted to give his son a red toy. We would, looks like SST, our meals, AA frost of the fly.
That was 2060 kind of.
Okay, that would be equate to, I don't know what J that is, but
I
okay.
think, what is that, J5?
See how, okay, so this is the same, so, and then, so I can legitimately read this one. Good. Well, not even good. It's still double. I can infer.
That's your right eye. Yeah.
So, I'm like, somewhere in this
J5.
area. I'm somewhere here from each eye.
You're like J7.
Okay.
Okay.
See, that's where I am.
14 left. I was saying he has about, just kind of trace to 1 plus NS in both eyes, what you'd expect for an average 49 to 50-year-old eye.
And like I was testing my dashboard last night. My dashboard is a little fuzzy on each eye with naturally, but with that lens, I regain computer.
Right.
Like right now, I don't even like to look at my computer without my glasses. So what I would gain is mid-range. I don't think I would have the near that I want, so I would still wear my glasses to do paperwork and read it fast. But it would give me something, it would give me more function. I get floaters, I get a little halo, but it's my non-dominant eye. I don't know. Part of me says do it.
Would you want to do your right eye though?
No, I would do my non-dominant eye.
Right. So if we did a symphony, we targeted plano or minus a quarter, you wouldn't have as bad halos. At minus 75, I find people notice the halos more too.
And when
I think
people
Rainbow
sit in
is
your
more
chair where
preferred.
you are, in that chair where you are, and you're going over the same thing, I would say 90% of the time you say, wait.
There's
Yeah.
two, yeah, and I would agree with that, but there's also two things to keep in mind with this. Like I said before, number one, those patients don't have the education in the
Sure.
background. He knows what he's getting into. Those patients don't necessarily know what they're getting into, and they have to take his word. I mean, the reality
Really
is
is.
I tell any young patient, you're going to need a YAG. And I think that's the other thing with your...
If I get it, yag me early.
Yeah.
So I don't get that dense plaque.
No, yeah, that's what I was going to say. I think with your level of awareness with your vision, you'd probably be an early YAG.
You should just wait.
Right. I think waiting's always
I
a good
think
option.
waiting's a good option.
But
Mull over it. Think about it.
I'll
Yeah.
think about it.
Yeah.
While testing
I'm
yourself.
actually trying to think from the third person, how bad am I really?
Yeah.
And I realize it's getting worse and worse and worse. So it's not I mean, yeah, I gotta wear glasses. I can function with glasses. There's no risk there.
if you go back to the central premise that I mentioned earlier, and I know you're not the average patient, but let's just say you were the average patient, would I ever recommend doing a Symfony on you? No.
Yeah.
So you kind of got to factor that in. The only reason I would consider it is because you know the risks more.
Yeah.
You know what you're getting into. That's
Yeah.
the only reason I consider it.
Yeah. And then I see some of these patients like that guy,
Mhm.
he's only like 48.
Mm-hmm.
They see great.
What was his pre-op though?
He's hypro.
Aha. See.
But they see great. They see great. They
But-
see 20/20 like J1.
But he couldn't see diddly.
But they see 20/20 J1 and they walk in and they're now seeing better than I am.
Yeah.
I get it.
It's kind of like
You know,
Like,
yeah,
I'll tell you something. Here's another thing. So let's say I'm that 1 in 200, and I go, oh my God, everything is so bizarre. If you took out a Symfony and you had to replace it with a monofocal,
Yeah.
I actually think I would see the same as I see now. I would have no
Yeah.
worse accommodation
Mhm.
than I have now. So that's
You're losing nothing, yeah.
I'm losing nothing with my accommodation.
And I could.
I'll talk it over with Betty and think about it, but.
I'm definitely in no hurry to do it, but if you want it done, we can consider it.
Okay, so true story. When I was doing surgery today, I thought, I think the staff has talked me out of it.
Mm-hmm.
Now as I'm sitting here, I'm leaning more toward it. If it's held too close, that's how I see it. When it's held further away, it's in better focus. Okay, so I'm going to preview what it looks like to be on the other side of this device that we use all the time, the LensX laser. So underneath the microscope, for your right eye,
Yeah,
and then read the smallest row.
it's the bottom one.
Yeah, read that.
428739.
And it's sharp.
It's sharp.
There's no ghosting, no doubling, no
Not,
shadowing,
no,
nothing.
not like there used to be.
Okay, now hang on, keep it there.
Yeah.
So about, let me see here. How far away is that? That's like maybe like 18, 20 inches. Pretty
Yeah.
good.
Yeah.
When you look at those numbers, are they sharp?
There's a little ghosting, but it's like the image. I mean, I can read it. 8:35, March 17, 11:32, 74
Hold
was
it
your
at the
heartbeat.
distance where there's no ghosting whatsoever.
Right there.
It's in perfect focus right there.
Yeah, it's really sharp. There's just, I mean, because there is a little bit of radiation, radiance.
How about if you use both eyes then?
It's pretty perfect. Yeah, right there's perfect.
Interesting.
We're just playing.
Gosh darn it, Tony. So, how bothered are you by your vision?
My far is really good, but my near is just, it's going. It's not getting any better. It's getting worse.
All the time? Just nighttime, daytime?
Everything.
Okay, so I can
This is probably HIPAA okay, right?
I can read this stuff. Yeah, let's put it on this. I can like read this. It's all fuzzy there. I have to get to right there. It's in best focus, but it's like I'm getting too far away to see it. So if I had to read this contact lens label, can you get it in focus?
Oh yeah.
Okay, so this contact lens label let's see here. I don't have my reading glasses on. Okay, so where can I see it? Oh, if I kept it in the shadow,
Your arm's not long
I
enough.
can read it. I can read plus 75 here at this distance. It's blurry here. Okay, now this little stuff here, it's impossible. I can't do it. This stuff here will stay here. Okay, so whatever this is, above my thumb, I don't know what it says. So let's do this near part. This is right eye.
Is that your dominant eye?
My dominant eye. This is the eye that I want to have surgery on. Okay, my dominant eye. Can't read this. Can't read this. Can't read this. If I keep it kind of dark, can't really read that. I could guess that, but it's not clear. In fact, I can read this. I can read that. This is not sharp. So everything is kind of blurred. It's just not sharp. So what I'm finding is my patients are seeing better than me. My patients who are like, with the Symfony lens, they can read here, and they read it sharp. I can't read that sharp at all. So, and what's the worst case scenario? Worst case scenario is when the Symfony lens doesn't work, they read maybe here. Well, that's no worse than my natural vision. So if it's a fail, it's probably as good as what I am right now.
I see.
When I'm outside of the office, it's actually most bothersome because I'm in an unfamiliar element and I have to read things at different distances that I'm not accustomed to. And I'm like, on, off, reading document, on, off. I can't see anything up close. So it's getting more and more frustrating. So there's a 1 in 1,000 risk. So the analogy I think is you have 999 white marbles. There's one black marble. You shake it up. The risk that I have a catastrophic problem is I put my hand in there and I draw the black marble. 1 in 1,000. It's pretty low risk. I'm going for it. That's the way I think of it. So this is my work environment. Every day I come in and I can't see this computer unless, or I can't see it clearly unless I put these on. So I'm 49 years old. I am just tired of not being able to see up close. I realize you can't have it all. You can't have perfect vision to infinity and perfect vision to 2 inches away. But I'm just at the point where I'm treating patients every day and giving them vision correction technology, and they're ending up now seeing better than I am. So I have a choice. I could do nothing. I could just keep doing what I'm doing, wearing my reading glasses, but everything up close is fuzzy. Even when I have social conversation with somebody, I'm talking to them, I see them, but I don't see them in perfect focus any longer. Maybe on one hand, I could just accept that and then talk to everybody and know that when I speak with them up close at conversation distance, we're just going to need to speak with my reading glasses on, and that way I can see them perfectly. Or I'll just speak with them here so there's nothing in between me and you, for example, but then I'm just not seeing you as perfectly as I want. It is now, see, here's another detail. This is a Fitbit. This is a Charge 2 Fitbit. I cannot read this from this distance right here. It is all fuzzy. It is 6:10 and I can't tell the date. I can see that I've got like 2,000 calories burnt or something like that today, but it's all fuzzy. I can't see that clearly any longer. So I'm going to get my vision corrected. It is now March 26th. My surgery date is March 30th. It's really what I'm trying to get is better up close vision, and I'm choosing the Symfony lens for my right eye. It's actually the Symfony lens that corrects astigmatism called the Symfony toric lens. Life has risk.
The risks of laser cataract surgery are very small, and I'm willing to take that risk. So that's the plan. It's Sunday. Surgery scheduled for Thursday. We're ready.
Okay, you shouldn't show him your calculations and then see what he comes
So
up
what do you
with.
think about my having this surgery, Christine?
YOLO. Acceptance. I just, there's so many people here that depend on you to pay for their
He's gonna be
dogs.
debilitated.
We don't know
hopefully.
that.
Much.
Do we know that?
Blank. Tomorrow is the big day. Tomorrow's the day I am choosing to have my vision corrected on my dominant right eye so I can see better up close. I've thought a lot about this decision, and it's taken me pretty much 9 years to finally make up my mind. So after doing thousands and thousands of cataract operations and correcting people's visions over the years, technology has continued to improve, and finally there's a lens implant now that I think will help me to see better, much better than what I'm seeing currently without any help. So I'm 49 years old. I can see perfectly far away. I've always been able to see perfectly long distance. When I was younger, I could read just fine, no problem. So I really never needed glasses at all. Then probably when I was about 43, I noticed I couldn't read a serial number on the computer. And I couldn't then read product license information to register software. This was, I guess, 6 years ago. What happened is, initially, I would just grab glasses every once in a while because I really could function without them to see up close. But then I realized I needed glasses with me all the time, and if I didn't have them with me, I literally couldn't read certain things up close. A couple of aha moments were when I had a cell phone, and it was maybe like an iPhone 3 or something like that, or maybe it's the original iPhone. And I looked at it and I couldn't read something well, and then I put reading glasses on and I go, oh wow, each of these little icons here actually has detail to it that I never really realized was there. And when I had my reading glasses on, I could see it fine. So then, in addition to packing my keys, my wallet, and my phone when I left the house, I carried my reading glasses with me all the time. I would go to work and not need glasses for most things, and I would just pull out glasses every once in a while. That was probably age 45. Then gradually, I realized I had to pull out my reading glasses so often that I simply reached that level of acceptance that I needed glasses to read near. And so I just left these glasses on my head. So when I go to work, I wear these glasses on top of my head, and I don't really care. And I was doing fine because I could still see my computer at age about 46. I could see my computer just fine. I just needed glasses to read something small like this. It's a small print, like that's an alcohol pad. I would use reading glasses to see that, and I'd hold it further away. Then what has happened over the past year is I've noticed not only is my near vision blurred, now it's my mid-range vision. So my ability to see the computer, to see faces. So for example, in a social situation when I'm talking with people and maybe the lighting's not great and I'm only about, 2 feet from them, I can no longer make out the details of their face sharply. I've been using this new lens called the Symfony lens since September 2016. So over the past 7 months, I've put in about 200 or so of these Symfony lenses, maybe more. And my patients are seeing better up close than I am. And they say they see fine. Their night vision is excellent. Do they have any artifact around lights? A little bit, but really not that bad. The quality of vision is outstanding. I'm going to have my vision corrected with a Symfony lens. Dr. John Odette is going to do it. I know there's a small amount of risk, but it's very small, and the upside is great. I see this as almost like reconstructive surgery. I've lost function. I've lost the ability to see without glasses near and mid, and I've had that all my life. So my objective is to get better, at least get that mid-range back. If I get the near back, that's icing on the cake. Somehow I'm not too worried about it. I know the team, I know all the nurses, I know the staff, I trust them all. I know Dr. Odette, I trust him, I know he'll do a great job. And, you know, hope for the best. Yeah, there are risks, but they're small. The upside to me is far greater than the risk. So there's risk, which is down here, and then there's upside, which is way up here. I'd rather just focus on that, see better now. I think the technology is good enough. Will I see like I'm 21? No, but I'll see like I'm 40. I can live with that. At 40, I barely wear glasses. And if I barely have to wear glasses now after surgery, it'd be awesome. Makes it like a real
That's right.
hospital type setting. 22.5 on the right eye, that's for me. Those are his measurements. Where's my measurement?
You want to sign this last set over here, Abby? Yeah.
22.5 DXT150.
I'm going to take a picture of you two.
I have a Ryan too.
Together. Come on, this is a
He's
moment.
my baby.
I'll try. Well, we should just take you in and get you all set up in there,
Let's
right?
do it.
Why are we just sitting in here? Let's go.
We're wasting
Yeah,
time.
we're wasting.
Bye-bye 49-year-old lens.
For those 6 bright lights, you're going to feel some pressure. Here's the pressure.
Awesome, you're all done. You did great.
Is that a good boy?
Perfect.
Well, good luck.
Thanks,
See
Christine.
you tomorrow.
We'll always have this moment. It's pretty wild. So I can still see it at the side, but it's pretty blurry. World collide.
Come full circle. And then, okay, have a seat. All the way to the back.
So far, no pain. Because the whole field is like white. You have a bunch of air bubbles and they see right now.
Yes.
So I'm just looking till every day. I feel a little pressure here. My vision lashes are coming down in the way a little bit there, but.
The more they do, the better it gets. But
You get my sticky stringy portrait?
that's what I'm about to do. Put the 3 bright lights again. Right there. Yeah.
I'll do it.
Perfect.
Thank
Good. Take the sticky off.
Okay, so yeah, I see the rose color. It's like betadine color. It is painless.
Good. John said it went perfectly. I did talk to the doctor afterwards.
Been on.
Oh,
Okay, so we finished. We finished surgery
Great.
5 minutes ago.
Yes.
So are you on?
Yeah.
So this is Dr. Odette's card, and I'm reading it right eye, so I can see 236844694. That's his phone number.
You know his number though.
No, I don't.
No, we don't.
I can't read it with my good eye.
We don't memorize numbers
Are
anymore.
you
Well, it's not your
serious
good eye then.
already? 5 minutes ago.
This is
we
my
didn't have
this is
to.
my untouched presbyopic
Right,
eye.
you can't see it.
I
That's
can't read
crazy.
his
But with
number.
your
wow.
new Symfony eye.
He can read it. Isn't that?
That's
That's
amazing.
crazy.
Sweet.
Wow.
Sweet.
That's a good selling
Wow.
point to patients.
See, that's pretty good.
Yeah.
5 minutes after surgery, I can read this phone number better from this eye while I'm dilated and I just had turbulence in my
Ooh,
eye.
tomorrow it's gonna be awesome.
So, flash this up here, right there. I get the same refraction that Megan got, which is good. That's about right on target with where we should be. Look up. It's currently got a quarter diopter of cylinder at about 95. That's 1 day post-op. It's probably a little corneal edema. We'll see. And all right, interesting. So good. The lens is perfectly centered. He does have actually two little capsule stria right now, and they are at a diagonal. So we'll see if he ever notices those. Perfect. So what you're seeing there is the perfectly centered Symfony from about 5 o'clock to about 11 o'clock. You do see two little stria in the background of that slit image. Here's going to be the corneal edema that you can see at the better. See the quality of his current natural lens. His right eye was very similar. I would call this dysfunctional lens syndrome, but it's definitely not a bad cataract. If anything, traced to maybe 1+ NS going on there. Good, yeah, and I definitely see a little bit of what we would call the pseudophacodenesis that you notice in the jiggle.
But it's very minor. It's very intermittent. It's like I'll not notice it for half an hour, then I'll notice it just a little bit for like 10 seconds, then that's it.
Yeah.
It's pretty wild.
Good.
And there's a color distinction. So this is just 10 out of 10 white. This is like 9 out of 10 white. It's very interesting. So functional things. So I can do I can...
Preoperatively, I think he...
It's like J5, J7, J10, somewhere in that range.
He was reading in this range right here.
Oh, good.
Okay.
So normally I have my glasses on my head all day long. I forgot them at home by accident. I haven't had to pick them up the whole day. So like, can you pass me an alcohol pad? So normally this is impossible. So from this eye, I can read drug. I can guess that's fax. I can guess that says active ingredient. I can't read anything else. So now let's check this eye. This is after I had a light in mine for a second. Right?
Yeah, I've just shined that.
So I can see drug, fax, active ingredient, isopropyl alcohol 70%. I can see. Hang on a sec. Something, keep away from fire or flame, do not use with electrocautery procedures. See?
That's very tiny font.
It's pretty, that rocks. Okay, so that's pretty cool. What else is there? Everything is just, I'm very functional. This works, good. High five, high five.
Yeah.
That's cool. Yeah.